You know that to make a diagnosis, oncologists and pathologists realize that tissue is the issue and want a biopsy specimen. As an allergist and immunologist who is an expert in the runny nose, Dr. Suzanne Teuber also recognizes that tissue is the issue, in sort of a different way though. It is well known to allergists that persons who suffer from rhinitis, or to us non-allergists as the runny nose, have an uncanny predilection to engage in hanky-panky, which is snot nice. Dr. Teuber has graciously come to talk about the causes and treatment options of the runny nose, and take it from me, she is really one who knows about the runny nose. Okay. So she is a professor of rheumatology, allergy, and immunology in the Department of Internal Medicine at UC Davis, is a well-published and highly well-known researcher in clinical immunology, specializing in studies on allergens in tree nuts and seed allergens. Is that right?
Yeah.
Okay. So I would like you to bring out your handkerchiefs, all of you, and give a big honking welcome to Dr. Teuber.
Oh, thank you. What a nice introduction. Thank you. That was really sweet. Well, anyway, it's just so wonderful to be here today. I can't wait to launch into this. How do I get it going here? Oh, nope, I need him to hit the right button. Oh, that's right, F5. You told me, he told me. I was having a semi-senior moment, right? Okay, so yeah, tissue is the issue there. It's a wonderful invention. I loved it, yeah. So anyway, I just want to let you know Murphy's Law is also alive and well. That's why many of you have different sized handouts. I missed the deadline to get my handout into the wonderful organizers due to some family emergency things that were going on. And I said, oh, no problem. I can print it up on Friday. You know, I'm in my office. We've got a great copier there. Well, my goodness. Go in yesterday and the copier is broken. So then, you know, it's getting fixed and this and that. So I come back. They said it would be fine in the evening. I come back and, yeah, it was working. But then the toner ran out. And that was where I was trying to print 2 slides per page, so it was nice and large. I heard that that was the preference. So I couldn't find the toner. The secretaries were all gone. I didn't want to be calling people on their cell phones. I'm going, it's got to be around somewhere. So I started printing on another printer. And therefore, there's color versions of the 2 per page and black and white. Well, then that toner ran out. I hadn't found the other. I finally found. And in the meantime, I was going, oh no, I'm running out of time here. And so I started printing 3 slides per page, which I was told was acceptable, although not ideal. But boy, I ran through trees because the 2-sided printing didn't work on some of those office computers. So it ended up being an interesting assemblage of 4 different printers to get these copies. So I hope that you use the paper wisely, recycle it, write on the other side if you got one where I'm only printing on one side. But that's why it looks so funny. I apologize for that. But again, yeah, Murphy was alive and well. Then coming in the parking lot, I had the dolly because, again, I used so much paper, I had to use a dolly because it was so heavy for all these handouts. And I parked under a tree, of course, where I find out that there's lots of birds that roost there at night. Fortunately, there was only one above me and it flew away and nothing hit me. I was thankful, but it sure smelled over there. So I'm going along and then there's the curb. There's no handicap ramp over there because of the construction. I dropped a box, it slid off. The papers came out. I couldn't believe it. And so then I got it loaded up and that's when I finally made it here. So I'm very happy to be here. So we'll go through this wonderful thing. Yeah, Murphy's Law, it's good, it's good. So I love poetry. This is a sonnet about a nose. This is from 1840. My poetry reading voice is off right now. I got to get into character, but I don't think I can exactly. 'Tis very odd that poets should suppose there is no poetry about a nose. When plain as is the nose upon your face, a noseless face would lack poetic grace. Noses have sympathy, a lover knows. Noses are always touched when lips are kissing. And who would care to kiss where nose was missing? Why, what would be the fragrance of a rose? And where would be our mortal means of telling whether a vile or wholesome odor flows around us if we owned no sense of smelling? I know a nose no other knows, 'neath starry eyes or ruby lips it grows. Beauty is in its form and music in its blows. I had a good sense of humor back in 1842. So today I'm going to cover some of the basics of rhinitis, how common it is, and the effect of aging on the nose, common nasal disorders, by going through 3 cases. And as I go through those cases, I'm going to be spending a lot of time on a case involving allergic rhinitis because it is so common and are believed to be so common in our population, and there are so many over-the-counter medications, and this ties in absolutely directly with what Dr. Hirsch covered, the issue of polypharmacy and using medications that may not be needed or may have a lot of adverse effects that people may not recognize. So first of all, rhinitis, such a simple term. It just means inflammation of the linings of the nose. I mean, that's literally it. There are many different causes, allergic and non-allergic. We split it into 2, we lump that together, but that's many causes. There are also anatomical things that can predispose to people having congestion, obstruction, getting some irritation there, but that's just pure and simple it. So there can be congestion without a lot of snot. There can be a lot of snot without a lot of congestion. The snot may be thin and runny, come out the front, and not really be felt down the back. It can be thick, come out both sides, or kind of hang there in the back. Sometimes when people have that sensation of postnasal drip, it's actually not from the nose at all. It's actually reflux, where there's a tickle in the back of the throat from gastroesophageal reflux. So that's a very common thing we find too. When we look at the nose, all looks fine, we try things, and then we look at what's going on with reflux symptoms. Now, the prevalence of this in studies, 10 to 30% of adults, depending on the region, depending on the country, but this is true all over the world they're finding. One thing that has been found, though, is that if you really do a study in looking at the causes, whether it's allergic or non-allergic rhinitis, about 1/3 of those cases are actually non-allergic. And with aging, that proportion goes up. The allergic side goes down. So now if we take this room of people, if we go by that lower estimate there, about 50 of you should raise your hands if I ask who has rhinitis, either allergic rhinitis or some other kind in this room. Can we get a show of hands? How many of you have some sort of rhinitis? Oh my gosh, okay, this looks more like the 30% range. So that's what people say about, California, Sacramento area, but it's many, many areas of the country, and I wish I lived in one that was only the 10%, as I have it too. All right, now the changes that occur with aging on the nose. We have to bring up another poem. This one is from Richard Brautigan. He's a beatnik generation guy who died in 1984. So here's his poem. Yep, a long, lazy September look in the mirror says it's true. I'm 31 and my nose is growing old. It starts about half an inch below the bridge and strolls geriatrically down for another inch or so, stopping. Fortunately, the rest of my face is comparatively young. I wonder if girls will want me with an old nose. I can hear them now, the heartless bitches. He's cute, but his nose is old. There's an old nose before and after. So things to be thinking out about the nose. Sun damage. Look very carefully for skin cancers. Nose is a big spot for that on the face. Then we have the reason for the photo down below. Decreased connective tissue in the nose that allows the cartilage plates to slip a bit, resulting in a droopy nose. This commonly happens, and I think it's more common in men than women. And the problem with this is that it changes the inside anatomy of the nose a bit too. One of the problems is that the nose doesn't have its usual ability to flare when there's this sort of drooping that can happen, or elongation. We have a part of the nose that's called the nasal valve, and when you flare your nostrils, you can sort of feel that. Breathe right strips were invented to enhance that nasal flare. As people get older, some people have so much loss of that connective tissue strength that when they breathe in, the nose literally narrows, and it can narrow enough to cause a feeling of obstruction. If someone wore breathe right strips all day, they might feel better, but those are very hard to keep on all day. At nighttime, this can be a big problem for some people who may have sleep apnea, who may snore, and so sometimes people will wear those at night. But some people actually can benefit from surgery for that condition. Another thing that can happen is that the nose can get fuller. We heard probably earlobes and noses do keep growing a little bit, so to speak, and that's another change as well. Then I did mention that that change from the little bit of elongation of the nose can change the inside. This is a cutaway of the inside of the nose. And now I gotta see where. Okay.
It's on your right of the screen.
There, okay, I see. I gotta bring it over. Thank you. So here we go. The cutaway here shows what we call turbinates inside the nose. These are folds of tissue that come out, and below them are tucked away the openings to the sinuses. Now these tissues, when I look in the nose, I can see this pardon me. Where'd my little, why is that going? I wasn't hitting that. Can anyone see where my arrow is now? It disappeared. Well, I'll just live without it. You will have to too then. But anyway, those growths out called turbinates can enlarge with age and can enlarge when there are changes in the airflow pattern. That can also cause obstruction. And so we do have patients who really benefit from seeing an ENT doctor to shave that away and decrease it. And then they're actually able to get off medications that they were taking for nasal obstruction and congestion. More changes. There are changes in the nervous system control of the glands of the nose. It's very, very common as people get older, even just past age 50, to start getting a little bit more runny nose with various triggers, cold air, spicy foods, exercise, various things. A lot of people will wake up as they get older with a bit of clear mucus in their nose, a sneezing episode or two, but that's it. You know, they just blow their nose and go on with their day. I have some people who come in wanting medications for that, and I tell them, don't worry about it. But that's very common. But it can be very, very severe for some people with this real overactive nose with a lot of running. So that's a type of non-allergic rhinitis. Then there's also folks who, instead of having the runny nose, they actually get a thicker mucus as they get older. This is also just a change of aging. And then they notice more mucus in the back of their throat. And it really is a postnasal drip sensation and thicker mucus. That can be helped greatly by salt water. Then there are also changes in immune function. Older folks have less what we call mucosal immunity, and there's a higher risk for sinus infections. This is one of the reasons also we want people to be normal in their vitamin D levels. You've probably heard about that, being normal in vitamin D. We're not talking about mega doses and hopping on another fad bus like there was for vitamin C and vitamin E, but just being normal. And the reason for this is that they've found that when people have a normal level of vitamin D, they have higher levels of naturally synthesized antimicrobial protein. It's actually called an AMP, an antimicrobial peptide, on their mucosal surfaces and even on the skin. And this can actually help decrease the risk for certain infections. So this is something that in all my chronic sinusitis patients, I want to make sure that they are normal, and many of these folks will need a supplement during the fall, winter, and spring with vitamin D. Because we just want to try to do everything we can to decrease the need for antibiotics or other interventions, other medications. So I just figure that's just a little thing we can do. There's some very, very good research coming out on that. All right, so I'm going to go through 3 cases now that illustrate some very common conditions. This first one, this is a real patient that I have in mind, but I've obviously totally changed the name. I've called him Drippy Dan. He's 72, and he reports the onset of very, very runny nose about 10 years ago. He reports it's like a faucet, and it was very easy to find a picture of a faucety nose-headed person on the internet. This is a common thing. He sneezes a bit from this. He has 2 dogs, 3 cats, but he's never had any kind of symptoms around those animals before. He says he has mild seasonal allergies in the spring, but they're actually better now than they were years ago. And interestingly enough about this problem is that it is so severe when he eats something. He is embarrassed to go out to dinner with his family. As soon as he has some food, and it can be any food, not just a hot, spicy chili, Mexican yummy enchilada sauce, it can be literally a piece of bread will set off a runny nose. And I have to say, we see this quite frequently coming in as referrals for allergic rhinitis. Please evaluate allergic rhinitis. So just like the other patients I see with this condition, he has already been tried on lots of different antihistamines that he's used over the counter. Nothing has helped. So he thought it was allergies. His doctor thought it was allergies. On exam, though, the nose looked really normal inside when I looked. It didn't look allergic. We actually have an appearance that goes with that. And I skin tested him, although I figured he would only be positive to something from that spring, and indeed, it was just positive to grass. And again, grass would not cause symptoms year-round that he was having. But the big clue was that runny, runny, runny nose with eating. We actually have a fun name for this. It's called gustatory rhinitis. So this is a condition that is due to overactivity of nerve stimulation. We have, our gut is under nervous control of what we call the vagal nerve. When we eat, there's a whole mind-body connection. You see food, remember Pavlov's dogs that start salivating. This is all part of that reflex. When we eat something, we have reflexes that start going to stimulate gastric secretion, contraction, and this nerve plexus actually goes all the way up the esophagus and innervates our nose as well. And so with the act of eating, as people get older, there's less inhibition of this upward flow of this type of stimulation to the glands that make the thin, clear, runny mucus. And so as people get older, and in this situation where it's a disorder, it's really bothersome, there is an overstimulation then of the glands in the nose that make the thin, clear, runny mucus, and the result is a faucet. It's a nerve reflex. Now I should back up and say this is called one of the kinds of vasomotor rhinitis. You may have heard of that. It's one of our catch-all terms for a non-allergic rhinitis. There are other folks who have various other triggers where it may not be quite as bad, or there may be more congestion with it. And I mentioned some of these before, but exercise and some, the cold temperature changes, the spicy food reflex that a lot of people have, the local effects from capsaicin, from peppers there. Alcohol causes a lot of people to get congestion, runny nose, air pollution, cigarette smoke, so various other things too. But this particular kind that Dan has, gustatory rhinitis. Unfortunately, we have a treatment. So I wanted to put this down here very specifically because I figured there might be a few people in this room who actually may have this condition or know someone with it, because it does seem to be pretty common, though I don't have prevalence data on it. It's just that every week I see a few people with it. So it's called ipratropium bromide, and this is known as the brand name Atrovent, nasal Atrovent. And this is available in 2 strengths. We start it quite high if somebody is really socially embarrassed from going out and always has that handkerchief or the toilet paper roll on the head, but it works. This is one of these medications that has very targeted effects specific for the exact type of nerve stimulation on those glands. So we tell people to use the lowest dose that works and the lowest strength that works. Like I said, we'll often start high when it's severe. The dose is 1 to 2 whiffs in each nostril, 1 to 3 times a day. It can be quite variable depending on the person's response. And for people who have it with meals, we have them use it a half hour to an hour before they go out so that they don't need that handkerchief or the hanky at all. Actually, I'll go on here. This can be used in people who have bad allergies too, because some people with bad allergies, their symptoms of the runny nose just aren't well controlled. And so this is a way of targeting locally for that runny nose in those folks also. So anyway, he was very, very happy and actually wrote me a really funny card back about how his life had been changed, and his wife signed it and said, you know, all this stuff too about now that they're going out to dinner and friends are wondering where the handkerchiefs are. So it was pretty funny. And next case, this is about Stuffy Sue. And I love that smiling cat. This is that's Peanut there. So this is not really her cat, obviously, but you know, I'm just pretending. So her cat is a cat from her daughter that she had to take into her house with her husband because her daughter went away to the American Embassy in India, fortunately not Turkey. This was 4 years, actually this was probably about 5 years ago because for this patient. So she reports that as a teenager, she was so extremely cat allergic, she couldn't be in the same room with the cat without developing severe swelling of the eyes, itching, runny nose, sneezing, and asthma. So she's avoided cat pretty well for many, many years and was kind of nervous when the cat came to live with them, but actually has done pretty well. But she's very bugged by nasal congestion. So she had symptoms of sneezing, a little bit runny nose, itching. The itching was really bugging her. So she actually started taking over-the-counter diphenhydramine, which we've covered already, is Benadryl, at 25 milligrams morning and night. This helped all the itchy type of symptoms, but did not stop the congestion. And it's bothering her enough so she wanted to come in and find out what she could do, because they cannot give up this cat. So wanted to see if there'd be something else going on. And actually the exam was very consistent with allergies. The nasal mucosa looked pale and glistening, very typical for that. And we screened her for allergies to see if there was anything new going on. And actually she was positive for cats and just a few other seasonal pollens from the spring that really didn't bother her much. So the other thing that I found out was that she's been in 2 minor car accidents. And both of them were her fault. Nobody was hurt, fortunately, but that was very concerning. So I want to talk a little bit about allergies because everyone gets told when they get a runny nose, even when they're older, that, oh, it's probably allergies. Go take Benadryl, go take some Claritin or something. But actually, if you have the new onset of runny nose or sneezing after age 60, it's very rarely allergy. It's usually a non-allergic rhinitis. And antihistamines then would not be indicated. But we do occasionally see, that's where I put this caveat here, we occasionally see dust mite allergy coming on new after age 60. And we have some local data I'll show you from Kaiser about that, but there's been several studies showing that as well. But anyway, allergic rhinitis itself can last a lifetime. Fortunately, most people do have some improvement in their symptoms. In some studies, up to 1/3 of people who had allergies in their youth resolve as they get older. And I'm hoping I'll be one of those fortunate people as well. But in her case, she has greatly improved, massively better than when she was a young adult. Now, the other thing I wanted to bring up is that some of the changes with aging can make congestion more noticeable, more bothersome, and that seemed to be the case as well with her. So here's some local data from Kaiser clinics in Sacramento. I thought you might like to see what in our area folks are most commonly sensitized to. So this was 566 charts that were gone through to record every allergen that was positive on skin testing from these Kaiser sites. One of our allergy fellows did this, Rosemary Hallett, who's in practice with UC Davis now up in Roseville. And 65 to 70% of patients were positive to grass pollens, and surprisingly 60% of patients were positive to olive tree pollen. And as you know, they're putting in more and more olive orchards since it's such a great economic boon for the small business farmer. It's awesome. But also 40% cat, only 25% dog, dust mites about half. And then interestingly, other trees, weeds were only about 1/3 for each one. Molds, very low in our area compared to folks who are in the southeast. Down there, with all the high humidity in the summers, flooding, etc., very high problems with mold allergy. Here, Alternaria was our top one, and the others were less than 10%. Alternaria is a unique one. This is one that is a dry weather mold that is highly associated with asthma also. This is one that has peak spore counts when they're doing harvesting in the fall. For instance, the tomato harvest. It grows on vegetation, it's getting spewed into the air, very high spore counts at that time of year, and we also even see an association with asthma exacerbations for people. Okay, this is the data that shows there may be a second peak of sensitization to dust mites among our population in the Sacramento area. If you'll look here, the red thought control markers go to the blue bar that is for folks 60 years and older, and it's showing the percent of folks who had a positive skin test to those particular allergens. So for grass pollen, it was around, looks like 40% there, and you'll note that the yellowish bar is the 20 to 29-year-olds, and those folks are the highest in every category, basically, except for the dust mites. But with age, you'll see the blue bar goes down, except for the two dust mite species. That's D. terranicinus and Dermatophagoides Rhini. Crazy names, but anyway, those are the two dust mite species around here. And you'll see that it actually went up with age. There's a trend down and then suddenly a spike. So again, our data is very supportive of other reports around the country that this can happen. The little photomicrograph there, that's what dust mites look like. They are a very small mite that feeds on shed human skin scales. So anywhere they can find those, you'll find dust mites. And this was a shock to me when I went into the fellowship. I was fascinated by immunology, but I had no idea people missed work because of allergies. And then I started seeing patients and seeing how miserable they were. You know, eyes swollen shut, nose totally congested, misery. So school performance also for kids. Kids miss school from this. So we try to avoid medications if we can at first for treatment. We try to avoid the allergen. The only way to do that is if you know what you're allergic to. So that's where skin testing or blood testing can come in. Just doing the avoidance measures, you can change someone's sensitivity over a few years. I used to be highly dust mite allergic myself, and I would use myself to show medical students how incredibly allergic I was, and that actually went away. For animals, you have to get them out of the house. It can take months for the dander to go down. Here's another one. Another option is to enlist the aid of the family dog. Yeah. Or wash the cat daily in cold water, and that after the cat's been washed for about 7 days, the allergen levels go down because the cat leaves the house. It goes next door to the neighbors. 2 options. You can also wear masks. HEPA filters in a room may help. Consumer Reports does occasional reviews on these. They don't help dust mite allergy, but they help with other exposures a bit. And good old saline. I want to say here that there are many ways of using saline. It is now evidence-based medicine that saline can help with chronic rhinosinusitis, chronic rhinitis. There are clinical trials using this, so that's a good one. Over-the-counter herbal derivative. I have just one here. A lot of people like the idea of this. This is cromolyn sodium. It's an over-the-counter med approved by the FDA, originally derived from an herbal. So a lot of people just key in on that from Davis and like that association. But it's a purified, pure compound. It's safe. It's more effective than placebos I put here, but not so much as those nasal corticosteroids that we can use. It was equal in potency to good old Seldane that was off the market from years ago for its adverse effects. Hasn't really been studied since then, but it's there. This may have to be used up to 6 times a day to be effective, but it can work. Not for everybody, though. It's a very, very weak medication, but some people love it, and it can work pre-exposure, like before you go to a cat house. So, yeah. Oh, wait, I shouldn't use that term, huh? Oops, double entendre. This can be a good choice for older patients who want to avoid more systemic medications, who may have more mild symptoms and want something mild and gentle. It does not cause nosebleeds like those nasal corticosteroids can. Okay, then we also have other herbals that are out there that people always ask me about. I say stay away from them all because there are just so many things we don't know about them. We don't know about interactions. The herbals, the Chinese compounded ones, we have a lot of problems with contamination. Heavy metals, lead, mercury, arsenic, as well as contamination with other medications in them. So here you see in California, they tested some products. 7% of these compounded Asian combination medications had undeclared pharmaceuticals. Ephedrine, which is decongestant, source of our good old Sudafed when it's more purified. Chlorpheniramine, an antihistamine. So these are not safe to take. And I have a quote in there that from Richard Coe, a pharmacist at California Department of Health Services, where they really don't recommend these because this has been a continuing problem. He's continued to be publishing about this ongoing issue. We also have decongestants that are over the counter. And the sprays are known by brand name, things like Afrin, Vicks 4-way spray, some various things like that, or 12-hour. These carry a big risk for rebound congestion. But I want to say that these can be a good choice if you're just going to use it for a few days, because in comparison to the other option down here of tablets like pseudoephedrine, there is less absorption of the medication into your body and actually less chance of getting high blood pressure or some other adverse effect from it. When someone has a bad cold and they're at risk for getting a sinus infection, using one of those nasal sprays for just a few days may be a good option and help them avoid antibiotics. The tablets have horrible systemic side effects as you get older, and Dr. Hirsch touched on some of this. Pseudoephedrine can cause urinary obstruction. This happened to my poor dad. He had to come into the emergency room and get a Foley catheter. Increased pulse, insomnia, jitteriness. It's in a lot of over-the-counter medications that are now behind the counter, where you have to slide your driver's license to get it, because this is the drug that people were buying up and using to manufacture methamphetamine. Because of that, manufacturers went to an older one to add on to the over-the-counter cold medicines called phenylephrine. This is not an effective medication and yet still has all the same side effects. Never buy anything that says PE on it. That's the abbreviation that's used. It would not be approved nowadays to go over the counter. Now, the sedating antihistamines are available over the counter, and Benadryl is the big one. Chlorpheniramine, he mentioned some of these. These have a huge market share. We don't know the United States share, but in the United Kingdom, about 40% of people still reach for these, even though we have better ones on the market. Loratadine, though, does sedate 6 to 8% of people, and not that effective compared to cetirizine, which is more effective in studies as an antihistamine, but sedates more people, 10 to 15%. Gotta watch for this. There's now another one that's over the counter, fexofenadine. This one is actually the one we really recommend for older people because it does not sedate. It really is a truly non-sedating one in rigorous studies. So this, though, can be adjusted by dose if someone has a mild impairment in their kidney function, and may be able to get away with half a tablet instead of a full tablet. But I recommend that you think of that one instead. She's taking this diphenhydramine. It's interesting that it's advertised on radio. We'll be hearing ads for it this spring about what a wonderful medication it is to go out and start your day. Then at night, you'll see on late night TV advertisements for this same ingredient as a sleeping pill. Not good. Something's wrong with that picture. So I really think this could have caused her car accidents. And she's had a little bit of dry mouth too, but that's another side effect of this. There's lots of side effects of diphenhydramine, including urinary obstruction. I want to show you an Advil PM that the recommended dose is actually, it's 76 milligrams that they're using of this diphenhydramine, which is equivalent to 50 milligrams of the type of diphenhydramine in Benadryl. That is a high dose. That can sedate somebody through to the next day. That can cause urinary obstruction. That can cause confusion, cognitive dysfunction. Stay away from that. Here's another little comic. It says here, with 150 miles to go and fatigue setting in, Alan wisely turned on his anti-drowsiness device. Yeah, not good. So it's against the law to drive under influence of drugs. Studies show we may be impaired and not even know it. And that's where I'm going to talk here for just a second. People may not be sleepy on a medication, but actually be impaired. There is a difference. So when they've been studying this, they've given two different words. They've tried to use the word sedation when they're doing studies on cognitive impairment, like quick mental functioning, arithmetic, counting backward from 100, adding things, or fine motor reflexes that they can test in the laboratory. Whereas the term somnolence means drowsiness. It means how quickly someone can fall asleep. Those two terms, when they're studying them, mean different things. And they found that you can have some cognitive impairment but not be sleepy. And that can happen very easily with a drug like diphenhydramine or Benadryl. They found, too, that industrial accidents are increased when people are on these medications. Here's another comic. I told you I can't do laundry or use the stove. The allergy medicine I'm on says not to operate heavy equipment. Yeah. So we have some other choices. Nasal corticosteroids can be very effective. They blast away antihistamines in every single study where they've been compared head-to-head, but they can cause nosebleeds. Many patients find that just little doses of them here and there are just as effective as using them regularly. Then there are some there are some prescription antihistamines too that have less sedation risk. So there are some other options. We also have nasal antihistamine sprays. These need to be watched though, because one of them, the one azolastine or Astelin, can cause sedation in about 11.5% of people. The risk will go up with age. This is actually an older antihistamine. I don't recommend it for older patients. But there's a new option called olopatadine or patinase with a low rate of sedation. Then we also have Singulair, Montelukast. This one can be one of those combination medications that Dr. Hirsch talked about, where if someone has asthma and allergies, this could be a pill to help with both conditions and avoid more medicine. Allergy shots can be helpful also in older patients. There's always a balance of risk and benefits, and when there are other conditions going on, the older patient may not be a good candidate because they couldn't safely come through allergy shots. There are more alternatives coming onto the market at some point when FDA approves sublingual therapy for allergies. Dust mite allergy is under development for this type of approach. So for Sue, she did not want to wash the cat with cold water. She decided to stop the diphenhydramine. She tried the fexofenadine, and it really helped. She felt more alert. She also started using one of those low-dose nasal corticosteroid sprays. She used a generic Flonase. And she just used it as needed, ended up being one whiff about 3 times a week. Okay, I'm going to finish with this one, so I am going a few minutes over, I'm so sorry. So 10:50 right now. So this is a gentleman, I'm calling him the Triple Crown winner, K.P. Belmont, Kentucky Preakness Belmont. He's 72, not his real name, of course. He's had 15 years of nasal congestion, some runny nose, postnasal drip, severe congestion, driving him crazy. Makes it difficult to breathe at night. He snores. He's tried saline flushes. He's tried the antihistamines. He's also got high blood pressure. He's got enlarged prostate gland. He's on multiple medications. And he has ED, like erectile dysfunction. He says he can now pee like a racehorse. On exam, his nasal mucosa is red and swollen. His allergy testing was negative. And I call him a Triple Crown winner. This is because he was on 3 different medications that can cause rhinitis. Lisinopril for the high blood pressure, the Flomax for the prostate, and the Viagra. And of course he uses that at night, and then in the evening he has this horrible nasal congestion. So by changing medications around and actually not putting him on antihistamines, he was able to get much better. He still had a bit of a problem, and he found that if he did use the nasal corticosteroid spray, he was helped. And part of the key was using it correctly. On these aqueous nose sprays, when people spray them in, you have to wait a few minutes between the 2 sprays, because if someone just goes whiff, 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 the droplets will coalesce and run straight out or run down the throat. So huge difference by changing technique a little bit. They're now coming out again with some aerosol sprays that stay up there, but they're not covered on insurance as well. All right, so my takeaway points. Rhinitis is common. Allergic rhinitis goes down with age, thankfully. But non-allergic rhinitis goes up. And the conditions, the treatments can overlap for allergic and non-allergic rhinitis, but we can shave off medications by knowing if someone is non-allergic, which is nice because we want to get people off. We also want to avoid medications that cause rhinitis, and we want to have older folks avoid pseudoephedrine and all those old type of antihistamines which are on that Beers list. So finally, thank you.
Thank you, Dr. Teuber.
I guess we'll leave that on. Oh, thank you.
We're going to take a few questions. What does Afrin do?
Afrin is oxymetazoline. It is a decongestant spray that's a topical spray. So the liquid is sprayed up there and constricts blood vessels. This results in a decrease in swelling or edema of the tissues of the nose. And it can work very quickly in about 5 minutes. If someone sprays 1 whiff up each nostril, they'll feel a sensation of it shrinking down if they have a cold or congestion. And then the idea would be to see if 1 whiff is enough. and if not, to use 2, waiting about 5 minutes. 3 is the absolute maximum dose, and again, this medication can cause horrible rebound congestion rhinitis, so it cannot be continually used, or people basically, you could say, get addicted to it. They get tolerant to it and they need more and more. So that's the big danger of it, but it can be very appropriate used for just small periods of time to get through a cold, get through something, to avoid antibiotics for sinus infection. It can help keep things draining. Good question. Anyone else? He said I'm supposed to ask in the middle. So you up there?
Wait for
Oh,
the
how do we do it?
microphone.
Because apparently the...
Anybody with microphones, or am I the microphone here?
No, there's 2 out there.
Have there been any studies done on the effectiveness of bee pollen for allergies?
Oh, okay. Bee pollen contains a mixture of pollens, and so the specific single pollen tends to get diluted out in the commercial preparations. People cannot actually get enough pollen to work as a good immunotherapy by using bee pollen, but this is what they're actually working on for FDA approval, is to have these massive doses of pollen in a tablet that will dissolve sublingually and have the effectiveness of an allergy shot, or we hope it can approach the effectiveness of allergy shots. But at this time, it's not felt that the bee pollen dose is actually high enough to change the immune system like the medication or the pollens that are actually under development, with a similar thought, of course, but higher dose to get better effect. Yes. Oh, he's going to be in charge.
On your post-nasal drip information you're talking about, what are the effective dosage levels for vitamin D you could find?
For vitamin D, okay, that was again to keep your immune system normal for secreting these antimicrobial peptides, help immunity. There's no set dosage because people's diets and absorption of it vary. So we have some patients who are completely normal when we've checked them in the winter on their normal diet. We have others who need 4,000 units a day to stay in the normal range on their vitamin D. So fortunately, the cost of the blood test has come down as there's been more and more demand from physicians for this. So now it's very easy to ask your doctor, can we please check my vitamin D level here in the winter? And then you can use that as a gauge for how much supplement you might need. And you might not, but we're finding a lot of people do need it during the winter.
Middle of the, middle there, yes. Let's see.
His question on the vitamin D. Dr. Oz said we should be tested for it. So I was tested, I was below normal. Now I've slowly been increasing my vitamin D, and I'm not quite at the midpoint. I understand you can take too much vitamin D. So where in the normal range? Do you have any general recommendation for what we should change?
Well,
I'll try to repeat your question or summarize your question. As you heard from Dr. Oz, you're taking supplemental vitamin D. You weren't taking it, and he suggested that if you weren't where you should be, you should take more, but what is the right dose? Is that pretty much the...
Well, when I get my test results, I was first, before I had I was below normal. Then I started taking vitamin D. I had another.
yeah. Let me intervene, yeah. So I think I know what you mean. So basically the normal range now is set from 30 to 100. It's very difficult to overdose on vitamin D, but we still don't want people taking mega doses. So the range at which for the immune status effects to really be at their maximum for maximum secretion of this peptide has been felt to be somewhere around 40, 45. That's in the studies what they've been publishing. So if you're in there, that's great. And again, my specialty is just one aspect of all the research going on vitamin D, so I really can't comment for other issues. You bet.
What was the way to administer the nasal drops? Was it fast or 3 little drops, or was it a slow?
For nasal drops of...
Nasal spray,
I'm sorry, who's even asking? I can't find in the room. Oh, right here. Oh, thank you. Okay, so for basically all these nasal sprays, if they're an aqueous spray, you'll want to, and it's hard to do here at the microphone, you want to look down at your toes and hold the bottle straight up so the mist comes out in the finest particles possible. If the bottle is tilted into the nose, it'll come out as big droplets in a stream and just go down the throat. So you want that bottle straight up and down. So it's like this. You also want to have it slightly slanted away from the septum of the nose, as if you're going to the corner of your eye, just barely on that same side, so you don't blast the spray on the nasal septum. That's where people get nosebleeds. So with doing that, then, you tend to get the droplets to stay up there. And again, wait several minutes before doing a second spray, so they don't coalesce and run down. And again, there are newer aerosols coming on the market where we won't have that problem, where people will just hold it up and go sniff, sniff, or it's actually a puff, puff, and that's it.
I'm taking Mucinex, one Mucinex DM at night before I go to bed. Pretty well controls my nasal drip. Is that all right?
Well, Mucinex DM has dextromethorphan in it, I believe. That medication is an opioid derivative and may actually not be a great medication for an older person to take. It is a cough suppressant, again, in that opioid family. The Mucinex part itself, the guaifenesin, is a mucolytic. It's a mucus thinner. And how that works is that in some people who respond to it, it makes the mucus so thin they don't feel that drip. So people who get that thicker mucus as they get older may be helped by it, so they just naturally swallow all those secretions and don't feel that thickness back there. The guaifenesin itself that's in that is actually also derived from an herbal medication. It was a plant grown in northern Mexico that the native peoples there used to use for respiratory ailments, and people isolated out the active ingredient. That guaifenesin has a side effect of loosening stools too. So if someone has constipation and has that thick postnasal drip, then guaifenesin can be a wonderful way to avoid polypharmacy and cut out some constipation medications. So again, you're helping your rhinitis with people who have that thick mucus and constipation. So great question.
So you can save your toilet paper for something else. I want to amplify that dextromethorphan, which is also found in over-the-counter cough syrups like Rhinitis, can cause confusion. Don't use it.
A Beer's drug. Remember what he was talking about, the PIMS, the PIMSs? Yeah. But the guaifenesin itself is not. That one is fine to take. But you have to look for just the plain Mucinex or the plain generic, because the Mucinex price is 10 times as much as the generic guaifenesin. It'll be on the shelf next to it. Okay, next.
I find that when I have a runny nose and I'm blowing quite a bit, that one of my nostrils will start to bleed. And I wondered if there was anything I could do for that, make it congested or whatever. And I also wondered if
Whoops, I couldn't hear the second part of the question.
the second part was, is there anything...
Yeah, bring.
Is there anything that I could do to improve congestion?
Well, to answer you specifically, you would need to see me, because your situation, I would need your full history. So I really can't answer that. But as for getting a bloody nose with blowing, yes. As you get older, the capillaries on that nasal septum become more fragile and more easily breakable. Just as capillaries under the skin gets thin, the mucosa gets thinner. So vigorous blowing can do that. So we advise against that. And again, need to talk to someone about their situation to give specific advice there.
And is this ipratropium bromide an over-the-counter?
No, the ipratropium bromide is not, but I put that specific information in there so people could actually discuss that with their doctor if they have that problem. Because again, a lot of physicians don't really know about that specific sort of indication, and so this might be something where it is appropriate for you to go in and say, hey, I think I have this problem, can I talk to you about this? And again, it might be appropriate for you, it might not.
Is it possible for runny nose to crystallize in the nose and then you have to either melt it away in the shower or claw it away with the fingernail? Is that cancerous?
Yes. What was the last word you said? Is it cancerous? Oh, very unlikely to become cancerous. But if you have a sore that's not healing, that is of concern. But Crusting of the nasal septum can happen. A lot of people have little perforations where the cartilage is thin there. They get crusting. We really recommend that you be seen by an ENT doctor to have that evaluated if you have that condition, to make sure everything's okay. But otherwise, usually it is, and the recommendation is to keep it moist. So saltwater sprays, and they actually have saltwater sprays now that have a moisturizer that helps hold on to the moisture so it doesn't dry out so fast and crystallize. And those are ideal. So we recommend those actually over Vaseline, because Vaseline isn't good if you inhale it into your lungs, et cetera. But there are things that can be done. So with that, I would suggest seeing a doctor, get that area evaluated.
We have time for one more question.
Hi, thank you. I was just wondering if you could maybe briefly explain sort of the functional difference between the allergy situation that you've been talking about and asthma, which doctors up here love to diagnose in people all the time.
There's an absolute link. People who have allergic rhinitis are the folks who are at highest risk for asthma. 80% of asthmatics have allergic rhinitis that usually started before their asthma. Asthma related to that can come on at any age. I've seen 80-year-olds develop asthma. The new development of asthma is actually steady throughout adulthood. So if you have a population of 20-year-olds, there's going to be a few who develop asthma in 30s, in 40s, in 50s, in 60s, and 70s, and 80s. So yes, it can be related. There's also a non-allergic asthma. There's what we call various types of asthma. Asthma is probably about 5 or 6 disorders now we're finding. So, but the majority of folks, it is in the people who are allergic folks. So big link, and that's why it's nice to be able to combine treatments. So with combination therapy, like the singular, if someone's a responder, not everyone responds to every medication, you can cover 2 birds with 1 stone. Also, they found that control of the allergies, control of the nasal allergies, control of exposures will help control asthma if it's allergic asthma.
Well, thank you very much, Dr. Teuber. This has been a wonderful...
Thank you so much. Really, really enjoyed it.